On passe au deuxième atelier. Il concerne les enjeux de prévention. Prévention qui est un levier d'action pour aller au-devant de tous ces cancers jugés évitables. On en a bien parlé. Des budgets qui restent limités, c'est 3% des budgets de santé européens. C'est des réalisations qui parfois tardent à venir, sont compliquées à appréhender au niveau des agendas politiques à l'heure du Beatty Cancer Plan, qui ont fait une priorité. C'est aussi le cas de la stratégie décennale. Quelles actions communes et surtout novatrices engagées autour de ces enjeux de prévention? On va en parler avec la directrice de l'Association européenne des ligues, qui offre beaucoup à l'amélioration de la prévention, et en particulier, on en parle depuis hier, du code European Code Against Cancer. Elle est avec nous, Wendy Yared. So we're going to discover the three statements of this group. But as I said, prevention is a major issue for cancer. We know about this. Lots of initiatives are going on. But results can be viewed as a bit, if not low, not so visible, actually, because there's a lot of resistance on alcohol consumption, tobacco consumption. It was said today, this morning. So what is the main goal for you to step ahead? And I would say, recalling the title of one of your articles, I really love that title, to dance on new tunes. We're not going to dance on new tunes here. We could, actually. I wish we could, but it's not the place for it. But what should be the way to dance on new tunes on prevention?
Well, am I going to report back on the groups,
this is introduction. This is for you.
Okay,
and after we do the statement.
Yes, well, the idea to dance to new tunes is really, you know, we've been dealing with cancer prevention for so long, and the risk is still there, and the rates are still there, so we really need to be more innovative and think of solutions. You know, what can we do differently? We have to review what we've done in the past and what we can improve on. So this is what I mean by dancing to new tunes. And then also new partners. We have to find new partners, or maybe have new moves, but with the same partners, and see what works. And, you know, to your point, you were saying, you know, prevention, you know, we have a lot of resistance, but also something that is resisting, that is a challenge, is that actions in prevention takes decades to manifest, right? So, I mean, cancer can take decades to develop, so you change your lifestyle habits, but it might not show itself until afterwards, and, I mean, also bad habits as well.
Dancing on new tunes is one thing, and dancing on new tunes is another thing on the European scene. You have a dance floor, now the dance floor is Europe. Usually in prevention, we go national actions because it has to be linked to the cultural habits of the people, to the proximity with the cultural spirit of the people. How and why a European scale, a European dance floor, is that much important on prevention today?
You need to work together at the European level in order for the messages to trickle down to the local level. And indeed, you need to cater that. And if I can use the example of the European Code Against Cancer, which has been now developed almost 40 years ago by the International Agency for Research on Cancer. It was developed in English, but then it needed to be translated. So when you look at the literal translation, as you know, when you look at Google Translate, it doesn't always make sense. So we actually had to ask our leagues to help us translate, because it is the leagues, such as in France, here's La Ligue contre le Cancer, who knows how to communicate with the general public. So we look to them to make sure that the messages can translate across. And this is why it's so important to work at the international level. And I can tell you that there were also some difficulties when we're working in translating French. What is the translation in French here in France? But what is it in Switzerland? Right? So, I mean, there are different, but it has to be adapted to the local context, and I think this is very, very important, but it's very important that we already have as a basis at the European level, so that we can work together at the national level.
We saw yesterday on the Cracking the Cancer Code initiative that they had to translate in 12 languages the toolkits, and each translation was also a way to speak the patient language for each country. So let's go to the statement and go to see the first statement of this group. is to create a coalition of European cancer prevention stakeholders, which aim to promote evidence-based prevention, deploy intervention at your level, and bring priority theme to the forefront of European policy debates using targeted statements. So here you want a coalition to arrive, to come. Who shall join such a coalition? Stakeholders, which ones actually? And what shall be the agenda concretely of such a coalition?
First, if I can, before I embark on the initiatives that was agreed by the group, I want to emphasize that it was a whole bunch of people, stakeholders and experts working together, led by Anka, and we very much appreciate this. And Thomas Dubois has been doing excellent work in order to get us together. So in a way, we already kind of started this coalition, didn't we, for cancer prevention. But we also, when we were discussing this, we also realized and recognize that there are coalitions and networks that already exist at the European level. So we said, yes, we want to create a coalition, but we don't want to also reinvent the wheel. So we need to build on existing networks, existing coalitions, and then we also decided, we need to look at what are the themes. So these themes, why did we specify alcohol, pollution, vaccination, screening, inequalities, et cetera, because there are other themes as well, because we felt that in these areas, perhaps the existing coalitions either are not addressing enough or can do a lot more. And so this is only an idea that this could be a leading initiative to create a coalition, but it does need to be developed more further. But this work started only a few months ago, so you can see that this is not ending, and we're hoping that it will be taken on by the next presidency.
It's a coalition to advocate, to inspire, to exchange practice.
To address all the challenges and all the questions and what can we do more? What are the new tunes that we can develop?
And you want it as a step-by-step approach, this coalition, or something to be with an agenda at the first meeting and a roadmap to go?
Well, we need to map. I think that's very important, to map already what exists, to not reinvent the wheel, and then to proceed from there. So it's a work in progress, I believe.
Let's go to the second statement of the group. Promote a healthy environment and avoid risky exposure, notably through actions addressing commercial determinants and aiming for a tobacco-free society and the denormalization of excessive alcohol consumption, implementing a mandatory front-of-pack nutrition labeling which might be inspired by the Nutri-Score, promoting the integration of physical activity in daily routines and strengthening regulation provision related to pollution. As for the first group, this is a big scope of actions, actually.
Yes.
And some stuff are already done, like the Nutri-Score in some countries.
Yes.
What exactly is, how can a statement like this reinforce these actions? Because lots of them are ongoing in different states.
And I think we need to see, read what this is about, because we're saying to promote a healthy environment. So we're not making the responsibility solely on the individuals. We're saying that we have to create a healthy environment so that the individuals can avoid risky behavior. So, if you look at, again, if I can talk about the European Code Against Cancer, they are messages that are directed for the general public to follow, but it also says that policies need to be able to support. And this is what we're talking about here, creating a healthy environment. And we also said, we need to address also commercial determinants. And that's been, in this Congress, we already heard several speakers talking about industry influence, and, Madame Trillé-Noir also pointed out, that it's important to address the commercial determinants. And I think that that's something that we haven't done enough in. We've done a lot, I believe, in the area of tobacco. I mean, we all know tobacco industry is there, but how much do we know regarding the alcohol industry, about the sugar-sweetened beverage industry? So we need to address those issues, and this is, I believe, what is new here. How do we promote a healthy environment? I think here in France, you have done quite a bit. When you turn on the TV, I'm always impressed when you have the commercials, the advertisements for snacks, and it says, you know, manger, bouger, okay, it's fine to eat, but in moderation, and also make sure that you move. So I love that, and I think this could be a great example that other countries can follow.
Is it also the fact that the responsibility is not all for the individuals, but it also is for the states, because this is addressing them?
And this is important, you know, without such a message, without saying that the government is encouraging you and promoting such a healthy environment, it's very difficult for the individuals to follow and to have healthier lifestyles.
Next initiative, reshape communication strategy targeting population and training targeting professionals. This is something which is very important to reshape the trainings, to reshape the communication actions, yet on which specific aspect do you want to prioritize this reshaping?
When we were discussing in the group, we felt that, yes, there's communication to the general public by, for the example, the leagues, as I already mentioned, but what we felt was missing was training of the professionals. You're talking about employers. How much do employers know about, for example, if you run a construction company? How much do you know about the risk to UV radiation, the sun? You have your workers working in the sun every day. You don't know, maybe they're not necessarily aware that they're increasing the risk for skin cancer and, you know, melanoma, which is the most deadly form. And then also in addition, we were talking about health professionals, because if you're talking about medical students, you know, they're being trained in treatment, how to diagnose, but they know very little about prevention. When was the last time you went to your GP and your GP said, you know, what is your employment, and, you know, is there asbestos, you know, are you working in a bar? Do you drink a lot of alcohol? And, you know, do you work outside? You know, because these are they're preventive measures. Or, you know, you're above the healthy weight. You do need to lose some weight. I mean, at least my GP is too busy. You know, he will treat the disease, but he doesn't help prevent the disease. And I think, and this is why when the group was discussing, you know, we need to reshape the communication strategies, but we also need to target health professionals. Also, part of this is addressing the migrant populations and the underserved populations. And you mentioned that the European Code Against Cancer is already translated in the official languages, but it's also being translated, it has also been translated in the unofficial languages. So if you go to our website, for example, cancer.eu, you'll find the translations into Hebrew, into Chinese, into Arabic, because we want to make sure that it's reaching to all the pocketed populations that aren't necessarily reachable normally.
Is it also a way to address in that reshaping, like Olivier Véran said, the new tools like social networks, where there are a lot of messages that can be fake news stuff coming, and that it needs also to reshape the communication tools to be pertinent and to be have a larger impact on these new ways of communications?
Indeed, because we have many now new channels, you know, with the social media, and this is where all the fake news is coming on, and that's where it's really prolific. I mean, we know about the anti-vaxxers. They go on social media, and then people follow all the fake news. They frame it in a way as if, the other day I saw a message, I saw a chart that supposedly was from the World Health Organization, because they put the logo there, and then they put, you know, the fake rates, the dangers of vaccinations, COVID vaccinations. And if you look at it, it did not come from the WHO, but they put the WHO logo, and they took numbers, they threw it in to shape it, to make it look like it's real. And I think, you know, then the health professionals and the advocates for cancer prevention, we need to go back to the same areas where the fake news is appearing, and we need to address it with evidence-based information. And this is why we said, you know, it has to be rigorous, it has to be based on rigorous scientific evidence, and this is how we can make sure that we reshape the communications by reaching to the general public, and also using youth using our young populations.
And on these new ways of communications, the exchange of best practice at European level is very pertinent, because sometimes, like you told me about the Denmark initiative, where they created a platform to promote HPV vaccination after there was a promotion of non-vaccination on the social network. So this might be also tools that can be used by different countries and inspirations too. We have time for questions and comments from the audience here and the connected audience there. So if you have some points you want to address to Wendy, English or French, it's possible. Yes and yes. Just do a little presentation of yourself first.
Yeah, I'm Mathieu Apro, past president of European Cancer Organization. Hi, Wendy. I'd like just to continue on what was said about the way we communicate. We have all failed. Our way of communication has not worked, and Olivier Véran said it very clearly. And came to my mind a provocative way of thinking. We know that the best people to work in the environment of safety in the computer industry are the hackers. And I know that for sure because I'm indirectly involved in there because of family ties. I think we should use those that put up the fake news and convert them, and they would be the best to communicate the message. It's a little bit provocative.
Thank you very much, Mati. Excellent.
There was, yes, you had a point also. There.
Yeah, Christine Leclinch, I'm a French health economist. So thank you for your proposal and the restitution of the work of the group you manage. You mentioned in your first proposal the focus on the first 1,000 days, and I think it is an important topic, but what do you mean exactly by focusing on those first 1,000 days? It's my first question. And do you mean we need to focus on future young parents and on the baby and how to tackle with social inequality in health, which is very connected to the first, to this issue, I think. Thank you very much.
Thank you very much. Can we go back to the first initiative, please?
The first one?
Yes, where we talked about the 1,000 days. And indeed, it is about starting from as early as possible. Because when you start at the young age, you know, when they're already very little, and then also adjusting the parents, then you have a head start. And this is very, very important. And I believe this is built on a French initiative. And this is why it's there, because this is the French presidency. And you mentioned dealing with inequalities. Indeed, this is a big issue. And I think we will hear more about it later on. But dealing with inequalities, especially in prevention, is very important about the messages. We already talked about the fake news, because the people who initiate the fake news, they tend to target specific populations, the migrant community, in their own language. Because most of the information, communication that we get are in the languages of the country. Here is French. But then what they don't hear is if you're a Hungarian migrant or a Romanian migrant, you don't get that same information in your own language. And so what do? You know, you listen, you're targeted by the pockets. But thank you very much, because I think it's very important, the inequalities, and also when you talk about screening, you know, we need to make sure that screening services are reachable by the rural communities that are not just in the cities.
And the fact that you address this first 1,000 days might be an issue also for the coalition, as it says. And there's a question on the comment, more likely on the internet coming, saying that tobacco and alcohol are the most bigger problem. There's a lot of stuff done on tobacco, and alcohol seems to be a bit behind on the scene of these actions. How can the situation change? Can we expect an international tools like we have for tobacco with the WHO Framework Convention on tobacco tools? Can it be also maybe on the agenda of the coalition of European stakeholders to try to have these international tools for alcohol like tobacco? Is there another comment? Yes.
I'm here.
Yeah. Oh, yes.
Walter Ricciardi, I'm the president of the Mission Board for Cancer of the European Commission. I can tell you that all your proposal, all your initiative have been envisaged and supported by the board. And essentially, we also classify these different actions in possible implementation. The problem, we shouldn't hide ourselves that this is the most difficult part of the job. So we say to European Commission and member states, you cannot be serious to tackle cancer unless you tackle behavioral, social determinants of commercial determinants of health, because otherwise you are going to focus on the diagnostic and therapeutics, and you are going to face in the future the perfect storm, which means you are not decreasing the burden of disease, you are increasing needs and demand by the population, by a population which is aging and which is adding risk factors, and you are in a perfect storm because you have incredible technological innovation, but you cannot afford that because you will be having so many patients that you will not be able to treat. Even the equity approach will be in danger. So essentially we propose that. Unfortunately, this has not yet been prioritized, and we shouldn't hide why, because certainly we need a bottom-up approach, because we made a top-down approach, but we need a bottom-up. We need a strong collaboration with politicians, we need a strong collaboration with advocates, we need a strong collaboration with citizens, we need a strong collaboration with professionals, we need a strong collaboration with patients, because otherwise, in the past, these strategies have all been failing. Maybe just the tobacco, but now the new tobacco is the nutrition, the nutrition field. And already grower Arlen Brunton in WHO failed. So we shouldn't be aware, and we have to act together.
Thank you. Thanks a lot.
Thank you, Walter.
Thanks to Wendy for the presentation. Merci beaucoup à vous. Merci beaucoup à Wendy. On passe à la restitution du troisième atelier.